Hey, what's up, everyone? Can you all hear me? Yeah, we're good. Awesome. Okay, cool. Today we're going to continue where we left off last week with Nurse Brittany. We're going to be doing the different stages of shock. Now, before we get started on that, we're going to actually do a bow tie. We're going to do a case study. We're going to do some general questions. I want you to see how the boards are going to ask it because states of shock, the different types of shock, are very important, more so than the states of shock, the different types of shock. Because guess what? If I've got neurogenic versus cardio versus septic versus what's it called, hypovolemic, all these different types of shock are what? Differential diagnoses, which means that we are, in fact, building a perfect case study or bow tie, right? So, before we get started, we do have somebody that made it to the other side. Obviously, we started to limit our interviews, but we've got, I believe, and it is in fact, yep, we've got Nurse Kenny. Where are you at?
Hi, Dr. Z. It's Kenya, like the
Oh,
country.
Kenya. Oh,
Yeah,
I'm sorry. They
no
wrote it
worries.
wrong in my notes.
It's no
Nurse
worries.
Kenya. My
Yes,
apologies. My
it's okay.
apologies. So Nurse Kenya,
Yes.
tell us what you used of
Um,
NCLEX high yield.
okay, so hi everybody. I'm gonna go back to July 2022 live course,
Okay.
as well as all the free Zooms and everything else that was free. Um, and I graduated in 2021. Then we jumped on 2022, and this is my fourth attempt. This was my fourth attempt.
Wow. Fourth attempt. So
Mhm.
you've been with us for a couple of years, which is
Yes.
completely fine. We all have our journey, and
Yes.
my journey was much longer than 2 years. I wish it would have been, or 2.5 years. I wish mine was that short, but mine was, yeah, lengthy.
Mm.
Nonetheless, so we were on our fourth attempt. How many
Yeah.
questions were we?
Um, so I know how you always would say it's okay if it's 85 or 140 or 150, just be prepared. So I totally was prepared this time. But I did ask God, can you shut me off at 85? Because, my nerves. And he's like, no, we're not going to do that. And it was 85. It was 89.
Okay.
Yeah, and I took it and but I've also failed at 85. So I wasn't so excited because I didn't know
Well,
what to really think.
and
Um,
and that's what I tell people all the time. I go, it doesn't matter 85, 150, you can fail at any point, you can pass at any point.
yes.
So as long as you're doing every single question as its own and you are taking every single one as an opportunity to pass, you'll
Yes.
be just fine.
Yes.
We've been having a trend of 85 and out, and you were right there.
Yeah,
So definitely felt prepared going
I
into the
did.
exam. Good.
I did. Well, because I remember sitting here on this, not on the other side, but on the side about to take my exam, and then listening to everyone. They're like, I heard Dr. Z's voice. I'm like, I don't know about all that. I don't know if I would be able to hear his voice. And honestly, I did. And it was
Good.
really, really insane that I'm like, God, you got to help me because this is really hard. These questions are really hard. And then you would say, just answer the question, be a safe nurse. Just got to be a safe nurse. And
Yeah.
honestly, that's really, really all that I did. Now, mind you, this was my fourth exam. So yes,
Right.
I was extremely nervous and borderline want to give up. And I know you didn't ask me this yet, but I'm going to say I need people to understand that denial does not mean denial. Delayed does not mean denial. And I've always sitting here listening to everyone tell their story. I always was like, I really want to be on the
Yeah,
other
there's
side.
something.
And
Yeah.
here I am, and it's like worth every tear,
Yeah.
every moment. So I'm
Every
grateful to
moment.
God, and I'm grateful
So
to you and your team.
now in this journey, so you're back in of course in the live course, and the good thing is that even though you were in the live course in 2022, the on demand stayed up to date,
Yes,
which is what I tell students all the time. I go, the on demand is always going to be the most up to date version of the course. So
yes,
even if you were in a course, maybe a couple of years ago, as in your situation, you were still able to be prepared for the
Yeah.
next gen.
Yes. Yes,
So
I would.
that was amazing. So I'm glad that we were able to provide that for you throughout the process. What
Yes.
is your advice for people on the other side?
Again, this is going to, I've heard this so many times from other nurses, but do not give up. Honestly, every time someone would come on there and they'd be like, I passed an 85 or 135, I'd be like, God, when is it going to be my turn? When is it going to be my turn? And yes, you go through it's almost like stages of grief. You're like irked. You're like, this is so unfair. I've studied so hard. I do thousands of
Oh
questions.
yeah.
I do thousands of questions. And this is so unfair. How come? And I just was not giving myself the option of giving up. I wasn't.
Good.
And so I went into the exam and I changed my timing around. I did afternoon. I didn't know. And it was just my moment, my time. And I'm grateful for you,
Oh,
your
thank you.
team, and just for the rest of the nurses, keep pushing and have faith. That's it. You have to believe that you can do it, honestly.
Absolutely, absolutely. You know, and I tell this to people all the time. People ask me, I mean, I've had people fail from, you know, one repeat test here, first time test takers, all the way to our record is somebody came to me saying I failed 49 times. So yeah, mine it's on YouTube. 49 times. So you can imagine that everyone does truly have their journey as long as they don't give up.
Right.
And this is a true testament to that. So I am so proud of you
Thank you, Dr. Z.
for sticking with me for sticking with me
No,
from
I had no other choice.
2022.
I had no other choice. Your voice
Because
was already in my head.
well, you know, to me it's I tell people this all the time, and I think this is something that people should really take with a grain of salt. Not majority of nursing schools don't prepare you for boards, they prepare you for school.
Right.
It's a process, right? Like you go, you know, section by section by section by section. Over here what we're doing is truly preparing you for the boards and beyond. And of course, because you're in the course, you've got your letter of recommendation if you need, you've got me as your reference as you need. And
Very good.
remember, as I tell my students that are in the course, keep your invoice, and when you apply for a job, take it to them and say, hey, by the way, would you be willing to pay for this as a
Oh,
bonus? And whatever, like everything that you've spent with us, right?
right.
You email us and say, can you give me a copy of the invoice of everything that I've spent? Because some people spend a lot on tutoring, along with the course, along with
Right.
books. So we're like, hey, take it. You'll be surprised. They'll cut you a check or they'll add it as a
Oh,
bonus.
wow. Oh, well, that's
Yeah,
good. Thank you so much for that.
yeah. So little piece of advice for people that were in the live course.
Yes.
So
Yes. Thank you.
Nurse Kenya, thank you so much, and I'm so
Yes.
proud of you.
That sounds so wonderful of you calling me Nurse Kenya. Thank you so much, guys. And hang in there, everybody. Hang
Absolutely.
in there.
All right, Nurse Kenya, take care.
You too. Bye-bye.
Bye bye. All right, so let's get started. What a wonderful story. That was awesome. Um, let's get started with announcements real quick. Again, financial assistance letter. We're always trying to help. Tutoring available. We've got two new tutors. Nurse Grace has just joined us. Nurse Crystal has just joined us. They will be introducing themselves. We'll be doing a giveaway of free tutoring. Pay attention, free tutoring. We're going to be doing a giveaway with Nurse Grace and Nurse Crystal, 2 hours with each. We're going to be giving them away. So make sure you're following us on all our platforms. On all our platforms, make sure you are following us. Then the self-paced course, again, the on-demand is going to be the most up to date. So even if you can't attend a live course, don't waste time. Get started. Get on the self-paced course. Do it at your own pace. People that got work, families, so on and so forth. And then the March live course is up and running. We are only allowing a certain amount of people, a handful of people. We're keeping it very, very small because I will be the one teaching almost all of it, because we're going to be re-recording a lot of the on-demand and hopefully having new notes up and everything as well too. So the March live course, if you're even considering it, you should consider doing it now, because we're going to cut it out. We're not going to have a lot of people because I can't have a lot of distractions as I'm recording it for replacement of on-demand. Not that the on-demand is not great already. It's just that, you know, lighting, sound, all that good stuff. So there you go. That's the live course, 15th through the 27th. Again, we're doing a scholarship as usual. Those that know, the Hood Boy Family Foundation, my family foundation, a 501c3, a nonprofit, is doing a scholarship. We're providing it for the NCLEX for the course. So apply, apply, apply. Make sure you apply. There's no harm in applying, and hopefully you get chosen. My sister heads that, so she does interviews and chooses as well too. As a committee, we do that as a scholarship. NCLEX guaranteed pass. If you want to be guaranteed a pass, consider this. I am going to be having 4 hours of one-on-one tutoring. Only 4 hours do I have available. They will be available in March. So if you do want to work with me directly, there are only 4 hours available. There's a QR code and there's an on-demand. And we will call you. Somebody from the team. What's it called? Oh, I guess I'm sold out. I lied. I'm sold out. Scratch that. I am sold out. Okay, so questions, we will call you. Somebody from the staff will call you and speak to you as well too. All right, now let's get started back into what we left off from last week. So we have different types of shocks: septic, hypovolemic, cardiogenic, and I'm going to add in neurogenic. In each one of these situations, we've got something that is causing us to become hypovolemic and or not perfuse our organs, which means we're going to have end organ damage or go into multi-system organ failure. In sepsis and septic shock, we're going to have some sort of infection, hypovolemia, dehydration, hemorrhaging, burns, things of that nature. Cardiogenic, heart failure, myocardial infarction. And then how about, let's add in neurogenic, meaning something that has happened neurologically that is causing us to go into a shock state. So typically what you think of is spinal cord injuries. We can get cranial hemorrhages, any type of, mostly we're going to see this in spinal cord injuries. So that's the one I want you to focus on if you see it. But are the causes of the shock really what the boards are going to be asking? No, not necessarily. They're going to want you to identify or diagnose what type of a shock it is, which means it's a differential diagnosis between septic, hypovolemic, cardiogenic, and neurogenic. If I've got to differentiate between them, I said what? Infection, maybe some sort of hemorrhaging, burn, things of that nature for hypovolemia. Cardiogenic, heart failure, myocardial infarction. Neurogenic, some sort of spinal cord injury, brain injury, things of that nature. Well, I can build a case study, I can build a bow tie and ask you which one of these it is. And in a bow tie, which is the first type of question that we're going to do, in a bow tie, what type of a question is a bow tie really? Of the 5 types of questions, is it a select all that apply or a matrix or a grid or any type of situation like that? No. Is it an ask a graph question or a prioritization question? No. Is it a further teaching, further intervention question? No. It is, in fact, a freebie question. Diagnostic questions are freebies. So when you do a bow tie, I'm going to give you what it is. It is your job to diagnose it because I'm going to give you 4 differentials. Freebie question. But in all 4 of these, we are worried about organ perfusion. Organ perfusion, which means that I've got to get blood to my organs, correct? Plain and simple. In order for me to perfuse my organs, I've got to get blood. I got to make sure that I'm getting enough perfusion there. How do I determine if I'm in trouble when it comes to perfusion, organ perfusion? Well, here's the concept that you should know. Mean arterial pressure. Mean arterial pressure. And what mean arterial pressure is, it's going to tell us the average amount of pressure in the arteries. I mean, think about it. Mean arterial pressure. People just try to memorize MAP, MAP, MAP. Well, what does it really mean? It means the average arterial pressure that is going to my organs. Well, and so now with mean arterial pressure, I've got to be able to calculate it because it is a numerical value that is going to be indicative of the perfusion I'm getting to my organs. It's going to tell me if I have, in fact, adequate perfusion, or I'm going to be ischemic, or in fact, I'm going to damage my organs. So now I'm going to calculate my mean arterial pressure. How do I calculate it? Well, I take my systolic blood pressure and I add it to 2 times my diastolic blood pressure, and I divide that by 3. And I divide that by 3. Is med math something that is prevalent on the boards nowadays? No, not necessarily. But if there was something that I would ask as far as mathematically, I've taught a lot in the course. I'm like, look, this is probably dosage wise, this could show up if they ask. This is something, if they ask to do calculations, this would be something that I would be looking at. So I do my systolic blood pressure. So let's just do something random. I don't know. I'm probably going to need a calculator or somebody to calculate this for me. 90 over 60. So my systolic is 90 plus 2 times, actually, this should be easy math, 2 times my diastolic blood pressure. So 2 times 60. So what is that, 120? Divided by 3. So what is that? 90 plus 120. Good. Okay, so I'm going to go slower. 210 divided by 3, which means my MAP is 70. Now, what are the parameters? What are the parameters that I'm looking at? Well, normal MAP is 70 to 100. 70 to 100. Now, those of you that go into, for instance, the ER or that are in the ICU, do you think you're going to have to calculate the MAP like this? I mean, it probably shows it to you, but you should be able to calculate it, okay? Unfortunately, we're spoiled by technology nowadays. But you should be able to calculate it on your own, or at least explain to me what's happening. So when somebody comes to you while you're on the ward and you're like, or you're on the floor and you're like, well, their MAP is ... You're like, well, what does that mean? I don't know. I want you to be able to explain it. It's the average pressure of the arteries going to every organ. And between 70 to 100, I'm okay. 60 and below. So we've got a little window where we're still kind of, we got a little bit of teetering where we can be like, okay, we've got room. Under 60, now I've got poor perfusion. Under 60, I'll take under 65. I'll take even under 70. Normal is normal. I will take under 70 if on the boards. I will take under 65. Literature varies. But if you see under 60, we are freaking out about it. And then greater than 100 is going to let me know that we can potentially damage our organs because we've got too much pressure, which means we can damage our organs. In this one, poor perfusion, we've got ischemia. Remember the 4 I's of structural compromise. Who knows those from the course? The 4 I's of structural compromise, meaning anything that has inflammation, infection, ischemia, infarction, right? There you go. I see my students talking about it. 4 I's of structural compromise. I figured out the 4 I's of structural compromise, meaning anything that deals with ischemia, good, ischemia, inflammation, infarction, and infection can compromise. Well, if I've got a mean arterial pressure of less than 60, is that not poor perfusion? Is that poor perfusion equivalent to ischemia? It is. It is. But in each one of these shocks, hypovolemic, septic after the initial part, initially pressure goes up. But as we develop more into sepsis. So now, congrats, another pass. Congrats. I saw a couple of them in there. So congrats. Hit us up for an interview. But ultimately, septic, neurogenic, cardiogenic, hypovolemic, we're going to have decreased cardiac output. We're going to have shock. We're not going to be able to perfuse. So that ischemia, poor perfusion, is going to structurally compromise. Well, isn't that what I'm talking about when I say end organ damage or multi-system organ failure? It is. It is. On the opposite side, if I'm too high of pressure, meaning the arterial pressure, the average arterial pressure is too high, then can I not damage that organ? I can. Mean arterial pressure, something that is very important, I feel now for the boards, especially when dealing with shock and in real life. So last week you talked about these very important classes of drugs. I may actually do this as, actually, no, this one's already done last week, right? We did this last week. Sorry, I'm not going to do that. I want to get into mean arterial pressure because we didn't really cover that heavily. So we've got vasopressors. Now, let's get started on practice questions. Again, I'm going to reiterate because I'm so repetitive and I'm so annoying. But you just heard Nurse Kenya say, I didn't think I was going to have Dr. Z's voice stuck in my head. And lo and behold, was I stuck in Nurse Kenya's head? I was. So it's because I'm repetitive, because I've got this annoying voice that lingers in your head. But I promise you on test day, it will help you. So again, we're talking about 4 different types of shock. Do I have to differentiate them? Yes. If I've got to differentiate them, again, look at the questions that we're going to see. So we've got a nurse caring for a 65-year-old male who is admitted to the ER. Clue: altered mental status, rapid breathing, and fever. Hold on one second. What is our triad? We said our triad for sepsis is what? Our triad for sepsis is low blood pressure, so hypotension, fever, it could be hypothermic or febrile, and tachycardia. Good. Did I give you all 3 here? No, I only gave you 1. I gave you fever, but I gave you altered mental status. Could that be because of low blood pressure and heart rate? Yeah. Do you think the rapid breathing is some sort of compensation because of that? Yeah. So do you see that this is logical deduction and critical thinking? Is this what I'm going to ask you on the boards? Yes. Is this what I want to see in real life from you? Yes. When I interview you, forget on the boards, when I interview you, do I want to see that you can logically deduce and critically think? Yes. So again, I'm not going to spell it out for you. Confused and lethargic at home, found confused and lethargic by daughter. Shivering, indicative of the fever. Felt very hot earlier, but now feels cold. Has a history of diabetes mellitus, hypertension, chronic kidney disease. Now, of the 4 different types of shock, let's see. Well, I shouldn't have said that, but let's go for more clues. All right, we've got temperature, heart rate, low blood pressure. Do you see your triad right there? Because I do. And I didn't spell it out for you, but it's right there. So some other things that are concerning to us. Oxygen saturation, 91. Is that okay? No, absolutely not. And then as we go to the left, we're looking at ABGs. And I'm not going to get into the ABGs portion of it with pH. I'm not going to get into that because that's a whole different lecture. And then our lactate level, and I like to do it in millimoles. So this is going to be 5. And what we're dealing with 5. So did we talk about lactate? Did you guys get into lactate where we talk about below 2, between 2 and 4 and above 4, what that indicates? Okay, so a brief breakdown of lactate. Less than 2 and then greater than 4. So with less than 2, we're okay. We're talking about hypoxia, tissue breakdown, lactate. It's released. If we see 2 millimoles or less, we're okay. Between 2 and 4, we definitely have some sort of oxygen delivery issue or hypoperfusion or anaerobic metabolism, whatever you want to call it, which you would see right here. Above 4, we are freaking out about it. Okay, so we're at 5. So I'm scared. So good. Oops, these lab values are off. Don't pay attention to those. I don't know who made this, but that's wrong. So nonetheless, we still got our triad on the left. Our differential diagnosis: cardiogenic, septic, hypovolemic, and neurogenic shock. Based off of everything that we've seen, somebody logically deduce for me what we have. Septic shock. What type of a question was this? It was, in fact, a freebie question. It was a freebie question. With septic shock, cardiogenic shock, hypovolemic shock, neurogenic shock, in every one of these, we're worried about organ perfusion. Our mean arterial pressure is low, which means, what are we going to do first? Regardless, what are we going to do first? Fluids. Think about it. Somebody comes in with any of these shocks. Somebody comes into the ER, period. What do we always start first? What does that go back to? What concept that I've developed does that go back to? NIPA. Because in any of these situations, are we worried that they can take something orally? Absolutely not. So I made them NPO. Which means the second thing I'm going to do is give them IV fluids. I may need PPI as needed. I may need pain as needed. I may need antibiotics, but before I give my antibiotics as needed in NIPA, what am I going to do first? Thank you. Do you see how NIPA still holds true? We started NIPA in, we were talking GI, we're talking about in with seizures, we're talking about it in maternity, here with shock, and NIPA still holds true. Do you see the advantage that you all, why are we 85 and close to 85 and out? Do you see why? If you understand, was this memorization that I did right here? Was there anything that I memorized here? No, not at all. I logically deduced that this was cardiogenic shock. Septic shock, because I knew my content. I knew the causes and the signs and symptoms. I knew NIPA. I understand that when somebody comes in, IV fluids, NPO. So when would I do now? Let's do this. Encourage oral rehydration. In any of these shocks, am I going to do oral rehydration? No, I don't trust them, because what are they going to do? Which one to ask graph will happen if I do anything oral? Airway, aspiration, 100%. So do you see how I took it one more step further? Because I could ask a question regarding that, right? So that we're going to get rid of. Now, but do you see what I'm doing here? When you do practice questions, I don't want you to just answer the right ones. We got the right ones. We're good with those. I want you to tell me why the other ones are wrong. Okay? I want to know if you understand. Where would I use furosemide? In what situation? Heart failure. So which type of shock? Cardiogenic. If the cause of cardiogenic heart failure or cardiogenic shock was in fact heart failure, then I would hear what? What would I see? And okay, now, okay, let's take this a step further. Those of you that are my students, you know I love heart failure. Let's say, I know I see people smiling. Y'all are laughing at me, but watch what I'm going to do right here. If, in fact, I'm having cardiogenic shock because of heart failure, and I've got to use something to get that fluid off their lungs, what two types of heart failure am I dealing with? There's three. There's right-sided, left-sided, and biventricular. Tell me which two I'm dealing with. Left and biventricular. So whoever said complete, that would work. But again, we changed complete to biventricular. So right, I'm not worried about. No pulmonary issues there, right? So again, look at what, but do you see, if I was studying right now, I'd be like, okay, that's cardiogenic. Well, why do I need furosemide if it's cardiogenic? Well, my lungs are probably compromised, which means both my ventricles or my left side have failed me. So now I know the different types of heart failure. Now I go right back to day one in the course or on demand. So you see, I take it a step further. And am I doing norepi yet? No. I've got other things to do way before I even think about that. So again, 2, and is that number 4? I think that's 4. No, I wrote all over it. All right. Which means, what am I going to monitor? What lab values am I concerned about? Well, let's think about it. Lactate levels, we just talked about, right? We just talked about lactate levels telling us if we're getting proper oxygen delivery to our organs. So I want to see if our lactate levels are at 5, I need to get that below. I need to start seeing a drop. Hemoglobin, where would I look at hemoglobin levels? if somebody was hemorrhaging, right? I want an H&H. I want to see where they're at if they're hemorrhaging, right? So what type of shock is that? Hypovolemic. Good. Pulmonary capillary wedge pressure. Again, we're going right back to cardiogenic. And then JVD, going right back to cardiogenic. And then with all shocks, I just got done lecturing. With all shocks, we are going to calculate our mean arterial pressure. How are we feeling about this question? Do you see how much was involved in this question? In one bow tie? But how did you like the breakdown? Are we understanding it? Good, good. So I'm glad, because this is something that, again, I don't typically lecture on shock. So those of you that are in the course, this lecture will be put into the on-demand. Okay? This lecture will be put into on-demand. Okay? So those that have on-demand and that have the live course, you will have the on-demand if you have the live course. I don't know what section. Nurse Brittany, if you can start looking at what section we're going to put it under, so we can announce it to them before we're done. So we're going to put it onto the on-demand. We'll put it onto I don't know what section. I'll have to look and see what section. Nurse Brittany, if you can look and see what section we can put it on, that'd be great. And lo and behold. So those of you that answered this correctly, do you think self-paced is the on-demand? Same thing. So yeah, it'll be up. It'll be up. So, there you go. Do you see how people are getting asked a lot about shock? Shock is not an easy subject. It's not an easy subject. But I'd say a good majority of you were able to answer this correctly. Feel confident. Start feeling confident. If you're starting to get these right, or even if you're starting to understand it, feel confident. All right. We're going to take the same subject and turn it into a case study. Same subject and turn this into a case study. So again, we got the same exact patient. So I'm not going to read through this again. We've got a patient with septic shock. Okay, again, same thing. Right? So same situation, MAP, they gave it to you. Okay? They gave you the MAP, probably because, well, 89 over 4. Now, let's just say that you have to calculate 89 over 40. What is that? Is that 89? I can't even read what's underneath there. Oh, it's 80 over 42. Even if you have to just quickly calculate, right? 80, 40, right? Don't even have to do 42. Just estimate real quick. 2 points is not going to make or break it. 2 times that. So what is that? 80 plus 80. That's 160 divided by 3. That's, well, 150 is 50. And then you got 10 left over. So roughly 53. With the extra 2, it's 55. So 53 round. See? Do you see how I did quick math? But did I have to accurately do it? No, it told me straight up that this is less than 60. And that's good enough for me to know that this person's in shock. We already know this one is septic shock, so I'm not going to go through the whole situation again, just so we can get through the questions. All right, so, the first question's on here. Okay. Which 3 findings require immediate follow-up? Immediate follow-up. Am I going to use the method here? Yes, absolutely I am. I'm not deviating from the method. So am I going to start from the bottom? Yes. This is just to select all that apply. I just got to choose 3. They're telling me how many to choose. Am I concerned about the white blood cells? Not necessarily, because what's the word I'm going to use right now? It is Expected. Yeah. And can we do anything about it? No. They're elevated because they have an infection. What are we going to do? I mean, ultimately, over time, how about their capillary refill greater than 4 seconds? Is that something that we're freaking out about? Is there something that we could do about it? Okay, we'll keep that as a maybe. Okay. When you're doing this, we know we need three. So we'll keep it as a maybe because I saw a lot of people saying yes. We'll say maybe. Okay, we'll put it in our back pocket. Lethargy and confusion. Well, immediate, first, initial, priority, urgent, most concerning, immediate. Wait a minute. Is that not ask graph? Is that not which one of ask graph is it? It is 100% altered mental status. I know for a fact I'm choosing that one. I still have a maybe, but I know I'm choosing that one. Blood glucose of 240. What am I going to do about it? I mean, ultimately, like, even if I was to do something about it right away, is that what the issue is? Is giving them insulin with potassium going to do anything right now for their sepsis? No. And that's probably not even the reason why that's not even an issue right now. Do you see? I'm not concerned about that. Oxygen of 90%. Which one to ask? Look, first, initial, priority, urgent, most concerning. Hello. Yeah, absolutely. That is ask graph. We just found two of ask graph. Which leaves us down to 50-50. My blood pressure. And do you see how the method still works? Okay, the method is still working. Okay, I'm down to 50-50. I'm between my capillary refill or my blood pressure below, or my blood pressure at 80/42. Between the two, which one are you freaking out about? Again, ask graph. The blood pressure. What do you think that blood pressure is causing? Which one to ask graph is that blood pressure causing? It's caused by, I'll take two. It is causing altered mental status. I will take that. It is caused by sepsis. So you see, ask graph is still right in front of you. The method is still right in front of you. I've not deviated from anything. And we're doing a case study. Don't deviate. Embed it in your head to do these things. Do you think we got this right? Of course we did. You stuck to the method. You used ask graph. You found altered mental status. You found airway. You found sepsis / altered mental status. Great job. Uh-oh. Well, we knew that this was septic shock. So what do we know I'm going to do if it's a case study? If it's a differential diagnosis? If I've told you that this is septic shock, do you think you should automatically start to think right when you see that this is septic shock, you're like, oh, they're definitely going to ask about hypovolemic, cardiogenic, and neurogenic shock compared to it. You should right off the bat, the minute you see it, just like if you were to see a question that says, oh, this patient, pediatric GI, patient comes in with projectile vomiting, olive shaped mass. You're like, oh, that's pyloric stenosis. Oh, wait a minute. They're going to ask about intussusception, tracheoesophageal fistula, Hirschsprung's disease. Your brain should already be working like that. Your wheels should be turning. Right? So again, you start thinking like that. Now, this is where I say it's very important. This is how you should know you're ready. I want everyone to pay attention to me. One, I say to think like me, right? to think like a test maker, not a test taker. But the minute I saw this question and I was like, this is in fact septic shock. And I'm like, oh, they're going to ask about hypovolemic shock, cardiogenic shock, neurogenic shock. Then you're going to be like, wait a minute, I could have written this question. If you knew this was septic shock and you knew all the different types of shock, could you write this question for me? If you can answer yes, and you start to do that in every section of on demand, in every section of the course, you're ready to take the exam. You're like, I could have written that question. Of course I could have. I knew this was going to happen. That's when you know you're ready. Okay, here we go. Signs and symptoms. Well, I told you matrix and a grid are what type of question? Matrix and grids are what types of questions? No. Select all that apply. They are, in fact, select all that apply. Look at this. What are the 4 types of select all that apply questions? Risk factors, signs and symptoms, education, and concept. That's it. This is, in fact, right in front of you, signs and symptoms. And I'm telling you to select all of them. It's a select all that apply. That's all a matrix grid is. Don't overthink it. I've figured out the 5 types of questions on this boards. We just did a prioritization question. And now we're doing a select all that apply. But it's a case study. Yeah, I know. So what? It's still, there's only 5 ways I can ask a question on the boards. That's it. That's it. How do I approach my matrix grid? And y'all should know this by now, column by column, because I am not going to confuse myself going this way, jumping 1 to 1 to 1. I'm going to go straight down because I know septic shock. And I'm going to focus on septic shock. In septic shock, am I going to have cool mottled skin? And why? Yes, I am going to have cool mottled skin because I am not getting proper perfusion, which means, is my MAP going to be low? I just answered 2 back to back. In septic shock, and we're going to have fever. Well, it's part of the triad. Crackled lungs? No, where am I going to see crackled lungs? We just talked about this. Where I need my I need my furosemide, I need my diuretic and cardiogenic shock. Okay, good. Decreased urine output. Do I have decreased organ perfusion? Does that include the kidneys? Yeah. In this situation, think about this. All right, now let's just go back. Y'all are going to laugh at me and make fun of me, and I could really, really care less because I want you to see how nerdy I am, okay? I've got cool skin. I've got decreased urine output. What am I not getting out if I have no organ perfusion? And I'm hypotensive, that warm, red, oxygenated blood. Do you all see that this, when I teach you all this stuff, I can't make this up if I tried. I can't make this up if I tried. This is right in front of you. That warm, red, oxygenated blood. It's right in front of you. In septic shock, and this is going to be a little bit tricky, in septic shock, we actually do get a jump in our pulses, in our bounding pulses, early stage. Okay, that's going to be an early stage only in sepsis, because our body's going to naturally react to the infection. That's where we get that initial early stage septic shock. We're going to get the bounding pulses. So only in septic shock, because it's a response to what? It's a response to the infection. That's the initial infection. That's why I said early stage. So I'm teaching you that. Am I going to have a JVD in this situation? No, that's cardio. Okay. All right. Moving on to the next column. Hypovolemia or hypovolemic shock. I should be more specific. Hypovolemia is different. Hypovolemic shock. In this situation, am I going to have that cool mottled skin? Yeah, because I'm not getting what? Again, in all these situations, that warm, red, oxygenated blood out, which means I'm going to have poor perfusion. Do I have a fever in hypovolemic shock? No, no. Do I have crackled lungs in hypovolemic shock? No. Am I getting that warm, red, oxygenated blood out like I need to? No. So am I going to perfuse my kidneys or my organs, which is what I'm concerned about? Nope. In this one, do I have bounding pulses or am I actually dropping? No, we're dropping, right? So we're not going to have that. And then the last one is JVD. Do I have JVD in hypovolemic shock? Good. And the last one, cardiogenic shock. In cardiogenic shock, am I going to have that cool mottled skin? Of course, which means I've got hypotension or decreased MAP. Okay. Fever? No. Am I going to have crackles in the lungs? Yeah, I just said, am I heart failure, right? Decreased urine output? Of course, no warm, red, oxygenated blood. Bounding pulses? Again, only in septic shock that you see that in early stage. Only in septic. So no. And then JVD. Okay. We had 1, 2, 3, 4, 5, 6, 7. 7 times 3 is what? 21. 21. Calculate how many you got right out of the 21. Just an honest calculation. And give yourself a percentage. Good. 19, 20, 21, 18, 19. Okay, so let's just take 18 out of 21. So what is that? What is that? 3. What is that? What does that come out to? 70 something percent. What is that? 80? 80? What is that percentage wise? Somebody do the percentage. 80%? Someone do the math for me. 18 over 21. Is it 80%? 85%. Thank you. 85%. 85%. If you got even 18, 86%. Even if you got 18, right, and you're scoring that high, are you passing? So if you were dwelling on bounding pulses, you were like, bounding pulses, maybe that sounds like something cardio. Ooh, I missed one. So what? So what? Right? I don't want you to dwell on just one part of it, but the good majority of us have done very well on this. 80+%. 80+%, you're doing well. Now, let's see how we did. And lo and behold, not only did we answer all of these, we were able to answer with the question why. Not only were we answering the question why, we were able to take it back to the concept of that warm, red, oxygenated blood. I was talking to a student the other day. Actually, yesterday I was talking to a student. And I was like, look, I went to a Caribbean med school. I failed 5 times for step 1 before I finally passed it and all my other boards. And I was like, I'm not the smartest person. They're like, well, you went on to Harvard School of Medicine, Stanford School of Medicine, did all this stuff, this and that. I was like, yeah. I was like, I'm not smart. I just learned how to dumb things down. So that's what I did. I'm not smart. I didn't figure things out. I just learned how to dumb things down. I dumbed it down to warm, red, oxygenated blood. That made sense to me. I dumbed it down for myself. So it's not about being the smartest person. It's about making things understandable, right? If you didn't do well in here, you can always continue to work or jump into the on-demand or the course. All right, here we go. This is a drop-down question. Drop-down questions are what? 100% freebie questions, right? There's still one of the 5 types of questions. So I'm at risk for developing, give me a diagnosis. Is it going to be MI, ACS, or multi-organ dysfunction or failure? Yeah. Freebie question. Either you knew it or you didn't. And what's going to cause it? Freebie question. Is it the hypoperfusion, hyperglycemia, or the increased preload? Freebie, freebie, freebie. There's only 5 types of questions on this. I need you all to understand that. Look at how well everyone is doing, understanding the and shock is not easy, and applying it. And applying it. Bow tie. Case study. All right. So now we've got intervention, what's another word for intervention? Education, which means what type of a question is this? Select all that apply. 100%. Am I going to educate that it is expected to give them IV fluids? I'm going to educate them that that is something that they're going to do. Am I going to educate them that we're going to get them on broad spectrum antibiotics? Am I going to educate them to give them furosemide? Am I going to educate them to give them norepi? Good. And the reason why, if what was the caveat there? If MAP remains, not initially, if it remains, right, then we've got poor perfusions. Now we got to get that norepi. And then am I going to encourage oral fluid intake? It's still a select all that apply. It is still education. Tell me that there's something different going on here. There you go. Who just said it? NIPA. Educate them, right? And from NPO, well, that's NPO. Okay, then we got IV fluids. Antibiotics is needed. So whoever observed that, and I didn't teach it right now, I didn't say it, there you go. You really know what you're talking about. Excellent job. Excellent job. Aspiration risk. We're talking about ask graph. Excellent job. Excellent job. Do you see that you all are understanding now? Okay. So, which of the client statement needs immediate follow-up? So what type of a question is this? Immediate follow-up. Freaking out about. Yeah, it is prioritization, right? Are we going to use the method here? Obviously. So we compare 4 to 3 between my chest is getting tight and it's harder to breathe, which could be which one of ask graph. Airway. Or I'm feeling weaker and more tired than before. Which one are you freaking out about? Good. My heart is racing really fast or chest is tight, harder to breathe. Ask graph. I'm feeling very thirsty. Obviously, ask graph. Do you see it's right in front of you? Right in front of you. Sorry, I'm going to finish this case study. I know we're at 4 o'clock already, but I'm just going to go through. I think we've got one more. Okay, cool. All right, last question so we can finish this case study. So again, improved or no change, is this, what type of a question is this? Well, it's still going to be some sort of education because I'm trying to find something. So it is a select all that apply. So if their map went from 55 to 68, are they improving? They are. If their lactate went from 5 to 2.5, are they improving? Now, look, I don't know what urine output is, but what if I use the word remains? Isn't that a clue? Is that changing? I'm just kidding about not knowing urine output, but I'm just saying, if I didn't. But the word remains tells me that has anything improved? No. And then again, that word remains, is that indicative of any type of change? No. So you see, even if I didn't know anything, I should be able to pick out clue words that should show you exactly what's going on. And there you go. Cool. So those of you that were able to, remember we got trivia today. We still got trivia. Those of you that were here today, some honest feedback. What did you think about shock and the questions? How did you feel about the lecture? How did you feel about yourself and your application to it? Good, good. I'm glad. Again, we will put this on demand. It will be on demand for all the people that are taking the course. Self-paced, on demand, same thing. So I'm glad that you all learned. Remember, there's a lot of great concepts in here. And we did put this, our team, there's Brittany, Melissa, our whole team put this together. So we really want to take the time to appreciate them as well, too. And I want to thank you all for coming and joining me on a Wednesday. You could have been anywhere else. So I'm glad that you were with me today on this Wednesday. And I hope you stay for trivia because we got some great questions. And then if I did anything to offend anybody, I apologize. If I can get better, please let me know how. I'm going to be out of commission for a couple of weeks. I'm out of office. So with that, we will be doing, Nurse Brittany will be doing some reviews, practice questions, whatnot with you guys, whatever topics are going to be coming up here in the next week. So I appreciate y'all again joining me, and make sure you spread the word. That's all I ask. I ask nothing else from you, but spread the word. So that way we can get more and more people here, because the only way we can keep this going is if you all spread the word and we get more and more people. That's the only way we get this going. So again, thank you so much. And Nurse Brittany is going to take over. Let me make Nurse Brittany. Thank you so much. Your kind words really, really mean a lot to me. So it keeps us going. It definitely does. Keeps us going. Let me make Nurse Brittany host. And with that said, everyone, have a wonderful, wonderful, wonderful day. I will see you all not next week, but the week after. So take care.
Bye, Dr. Z.
Take care. Thank you, Nurse Brittany, for handling it from here.
Of course.
What would be correct instead of hypoglycemia? Hyperglycemia, exactly. So I see you guys were a little between metabolic acidosis and metabolic alkalosis. So metabolic acidosis happens because diarrhea causes that excessive loss of bicarb, that HCO3 from the intestines. Metabolic alkalosis would happen if the body was losing acid, but that happens with vomiting, not diarrhea. Okay, so let's see. What is the priority intervention for a newborn with cleft palate? So use a special feeding technique. Why do we like this answer? Yeah, so cleft palate's a birth defect, right? Where the roof of their mouth, it's not fully closed. So it's going to make feeding difficult because milk can enter the nose instead of going down the throat, right? So priority is going to be to use special feeding techniques to make sure that that baby is getting proper nutrition without choking or aspirating, exactly like all of you guys are saying, into the lungs. Exactly. And surgery is usually done, but not until after a few months. Why don't we go with phenytoin? So first off, status epilepticus is a emergency, right? It's where a seizure is lasting longer than 5 minutes, or one is happening right after another without, like, multiple seizures without regaining consciousness, right? So we have to do something to prevent brain damage, right? First line treatment is benzodiazepines. Benzodiazepines are going to be your first line. So that's why we go with option A here. Does that make sense to everyone? So phenytoin is going to be used after benzodiazepines to prevent more seizures, but it doesn't work fast enough to stop an active seizure, exactly like you guys are saying. Make sense? Why don't we go with fluid balance? Airway and breathing are going to be top priority, exactly. Why don't we go with headache? Yeah, you guys are right on point. So headache is an early sign of increased ICP. Nausea is an early sign. Irritability is an early sign. Cushing's triad is an emergency. We need to do something quick. That's a late sign. That's life-threatening. That's severe ICP. Okay, let's see our winners here. So just remember, guys, if you win first, second, third, fourth, or fifth place, please email contact@nclexhighyield.com so you guys can get your prize. Awesome, awesome. I hope everyone enjoyed. Congratulations to all of our winners. I will see you all. So Cushing's triad includes hypertension or widening pulse pressure, bradycardia, and irregular breathing. Those are like the three components of Cushing's triad. It's a late sign of ICP and brain herniation, and it is an emergency. We're freaking out when we see Cushing's triad. You're so welcome. You guys are so welcome. If you won, please email contact@nclexhighyield.com if you won first through fifth place. Okay, congratulations to all of our winners. And like always, we will see you next Wednesday night. You're so welcome, you guys. You're so, so welcome. I'll see you guys all again next week. Bye, everyone. Have a great rest of your day or night. Bye, guys.